hope lunch has given you the energy to match the conversation we're about to have, because this next session deserves your full attention. We now turn to the sector that more than any other reminds us why AI truly matters. Not as a productivity hack, not as a line item on a cost reduction spreadsheet, but as a force that can do something far more profound, save lives, restore dignity, and rewrite what's possible for millions of people. Healthcare in India stands at a defining inflection point. The numbers are staggering. The need is urgent. Rising demand is colliding with systemic constraints, cost pressures, regulatory complexity, workforce shortages, and a persistent, deeply uncomfortable gap between those who have access to quality care and those who simply don't. This is not a future problem. It's happening right now, in every city, in every district, every village across the country. And yet, within that challenge lies one of the greatest opportunities of our time. AI is no longer a distant promise in healthcare, as you have seen in the demo. It's already reshaping how diseases are detected, how hospitals operate, how clinicians make decisions, and how patients experience care. From AI-driven diagnostics that catch what the human eye might miss, to predictive analytics that intervene before a crisis unfolds, from intelligent hospital automation that frees up precious time for caregivers, to health data platforms that finally make sense of the complexity buried in our systems. The transformation is underway. But transformation without intention is just disruption. The real work, the harder work, is building a healthcare ecosystem that is not only smarter, but more equitable. One that doesn't just optimize for efficiency, but expands access. One that doesn't sacrifice ethics at the altar of innovation, but holds both in equal measure. One that creates sustainable growth for providers, for payers, for patients, and a healthier India. That is exactly what this session is about. Regenesys works across more than 40 industries. I say this with conviction. None carries the weight of responsibility that healthcare does. When we talk about AI in manufacturing, we talk about output. When we talk about AI in finance, we talk about returns. When we talk about AI in healthcare, we are talking about human lives. That changes everything about how we must approach it. This is a panel I've personally been looking forward to all morning. Moderating this critical conversation is someone who embodies the intersection of technology and humanity in healthcare. Mr. Manoj Nagaraj, Managing Partner, Regenesys School of AI, brings to this role a rare and powerful combination: deep clinical understanding, expertise in healthcare systems, transformation, and a genuine fluency in digital innovation. His work has consistently centered on what matters most: the patient. Not the platform, not the algorithm, but the person at the end of every decision a healthcare system makes. As Managing Partner AI in Healthcare at the Regenesys School of AI, Dr. Nagaraj will lead the charge in advancing AI applications that are scalable, ethical, and above all, impactful to the real world. He's not here to theorize about the future of healthcare. He's here to help build it. We're truly honored and delighted to welcome him to the Regenesys family. Ladies and gentlemen, please join me in welcoming Dr. Manoj Nagaraj. Over to you, Manoj.
Thank you, Shamita.
Thank you.
For the wonderful introduction. Hello, yeah. I was talking to one of my team members. I have a very interesting slot. She asked me why. My first slot is, before lunch, so I have a responsibility to make sure it is interesting. My second slot is after lunch. I also have a responsibility to make it interesting, otherwise they'll go to sleep. Anyway, so very good afternoon, everyone. Welcome to our healthcare panel discussions on a very interesting topic, building future-ready healthcare sector. As we all know, healthcare systems worldwide are entering a new era where artificial intelligence, digital infrastructure, and data-driven decision-making are reshaping how care is delivered, from diagnosis and prognosis to clinical and operation decision support systems. I'm delighted to moderate this discussion with an exceptional group of leaders, bringing perspectives from global healthcare innovation, hospital leadership, digital health, and technology entrepreneurship. So I would like to start the introductions from Manisha Karoria, Associate Director, Global Health, Equity and Partnership at MSD Pharma. She leads AI and technology partnership focused on improving health equity across low and middle income countries with experience spanning across MSD and McKinsey. Thank you, Manisha. Welcome to the panel. I would like to invite Dr. Manisha Bobade, CEO of KJ Somaiya Hospital and Research Center with over 35 years of experience across Apollo, Fortis, Reliance, and DY Patil hospitals. She is known for strengthening patient-centric care, leading technology-enabled transformations in hospitals. Thank you, Manisha. Welcome to the panel. I would like to invite Sumit Puri, CEO of Prana Wellness, with more than 30 years of leadership experience across healthcare, insurance, and digital transformation, including Evercare Group, Max Healthcare, Prudential, and GE Capital. He is currently leading an AI-enabled prevention-focused wellness ecosystems. Thank you, Sumit. Welcome to the panel. I would like to bring in Ravi Kiran Sripada, Director, Hospital Operations and Digital Transformation and Strategic Partnership at Sri Satya Sai Health and Education Trust, focused on scaling technology-enabled healthcare models for underserved communities. I would like to invite Abhay Agarwal, who is our partner and CEO of Clinic on Cloud, known for developing the healthcare kiosk model that combines diagnostics, telemedicine, and digital technology to improve last mile healthcare access. Thank you, Abhay, for joining the panel. And the last panel is Mr. Tribal Kumrat, who's the founder and CEO of Moist 10 Technologies, an entrepreneur working at the intersection of healthcare and innovations to improve healthcare delivery and operational efficiency through technology. So thank you, Tri. Welcome to the panel. So in the interest of time, we could begin the discussion. So I would like to start with what I call the rapid round, so which means all the panelists will have 30 to 40 seconds to comment. And then we'll move on to the next level, which is pointed at some panelists, which brings in the domain expertise. Are we ready? First questions, an interesting one. Healthcare is at the major inflection point with AI, digital health, and data-driven care. What, in your view, will define a future-ready healthcare systems over the next decade? 30 seconds each. Let me start with Ravi, please.
Thanks, Manoj. Good afternoon, everybody. I think we are at a great time in healthcare and with the merger of AI in healthcare. I think the most recent and a beautiful framework that has been developed by the Government of India, Ministry of Health especially, which was rolled out in the AI Summit that happened in February last month, is basically guardrails of how this needs to happen. Interoperability, I think even in the other panels we talked about it, it's probably the most important. How do we ensure that the data that is getting captured is able to talk to systems across various platforms? So the FHIR framework, we have Sahi and Bodh that the government has introduced, which is basically it's Sahi is the 7-step framework to ensure that there is human in the loop, the frontline healthcare workers who are going to carry this huge burden of managing the healthcare in our country into the most grassroots levels, into the deepest forests and the highest of hills, the Anganwadi and the Asha workers. How do we ensure that they are in the loop? How do we ensure that their training is happening? I think Sahi is the framework for that, and LLMs that are developed. We have an open data that is available now which was developed in collaboration with IIT Kanpur. It's called Bodh. That will allow Indian startups, Indian AI developers to use data which is very specific to our geography to train their models and make it relevant for our country. So I think with these, and of course we have Ayushman Bharat Digital Mission 2.0, which is trying to bring all of this into one single platform. I think with these 3 or 4 layers, it's going to be fantastic. There's going to be a lot of interoperability. It's going to give us a great platform to bring the entire country onto a very stable ground.
Thank you, Ravi. So the availability of the infrastructure on the digital health side from the Government of India,
Yes.
the guardrails, the availability of the data, and also the commitment from the government in terms of policies definitely will be providing the foundations to scale. Thank you. Abhay, want to share your views?
So this is a very interesting phase we are currently going through, with AI in collaboration with healthcare. So what I understood in last 6 months, the way the things are changing very fast, we can build amazing AI on top of the data. But the core thing is that we required a data set, a local data set to build a system on. That is the root point. Right now a lot of LLMs models are getting rolled out, which are based on data from UK market, US, different segments. But those models are sometimes not relevant to the Indian, from an Indian context, because India has its own problem. Like every country, in fact, has its own problem. So we have to build a system where foremost requirement is to reach out to the last mile. And I think that's what we have been doing, how we can collect the data from the ground, the data points and being localized. Like in India, every state works differently, right? The Karnataka might be having a different set of problems, Andhra might be a different set of problems, Northeast might be different. So how we are collecting the data from different states, and then everything can work on that data, right? So the foremost point is get the data out, then build an LLM on it. Apart from this, I think one thing which is still, which I see normally when I interact with people, a lot of apprehensions is also there. Doctors are feeling, might run, AI might replace them. That is also a lot of misconception is there. So when we are talking about AI in health, it is not just about implementing AI, but we have to address lot of misunderstanding, lot of misconceptions around this whole healthcare. Then only I think we will be able to roll it out in a much clearer manner. And also the government, as sir said, are also working on it, how to make it more ethical, because that is also very important. So it's a combination of addressing people concerns, implementing technology, and also make it ethical.
Okay, thank you, Abhay. So net, it's a quality of the data, and also the importance of sovereign models to train the data are very important in the whole ecosystem in terms of scale. Okay, thank you. Sumit, your thoughts?
Yeah, so I'll just probably start with a slightly controversial statement that healthcare in most developing countries is probably not healthcare, it's sick care right now. We have to move towards healthcare, we have to move towards prevention. So in some sense, we're basically saying that from reactive to preventive is what the intention is. It has to be more personalized, has to be more, I would say, data-driven, has to be more outcome-oriented. Okay. That's what the shift has to happen for. Okay. And we will need a lot of technology, but also processes and systems, and maybe innovation like Region Health, ATM, and a couple of others that we are probably also trying to do, to actually make that shift happen. That to me is the key question. Okay, so from a data-driven care, from a reactive to proactive, using the quality of data is fundamental for this transition. Thank you, Sumit. Dr. Manisha, your thoughts?
I think the AI, we always talk about this, it's a technological upgradation. I think it is concerned with the humanity. It's going to empower the doctors, healthcare much more better. So empowered human being is going to take care of another human being in much more better way. Okay. We can reach more farther, care better, earlier diagnosis. And it will make wonders because innovations and humanity will rise together.
Yes. Thank you. So importance of preventive healthcare. Okay, thank you. Manisha, your thoughts?
As someone who's coming from a pharma industry, I just keep thinking that whenever we talk about AI in healthcare, there's a common parlance that's being used. We say it's a 3S. You need the skills, you need the solutions, and then you need scale. I think the ingredient that we need to really think about when it comes for a future-ready healthcare ecosystem, specifically for a country like ours in India, we might be able to build the rest of the skills we need. We might get a lot of solutions. And as he said, I was part of the board launch that happened in AI India Summit. We'll build great solutions. Are we ready as an industry for the scale that we need is something I think is what we need to discuss about.
So the importance of 3 years,
Yes.
critical for the transformation and scale. Okay, thank you. Try your thoughts.
Yeah, Manoj, to me, I hope you're able to hear me, yes. Yeah, to me, I think in next 10 years, we'll see a lot of transformation around the infrastructure first, right? AI can do a lot of things. We can see in front of our eyes. You showcased your equipment in the morning, and we read in newspapers also, in news channels also, we see China has implemented such, healthcare equipments also in their, house, what do you call, metros and all that. At the same time, we need to see that our infrastructure, the data readiness is there in terms of the global standards like your HIPAA or FHIR, SNOMED, clinical terminology standards and all that. So I would expect that thing has to be kind of, prioritized in India context so that we can get there quickly. Okay. So that would be my, vision towards AI readiness.
Okay, so the importance of infrastructure and the compliances.
Absolutely.
So that build a trust in the patients and help us to scale. Okay, good points. Thanks, everyone. So moving on to the next questions, another interesting one, maybe close to hospital and the practitioners. AI is transforming patient journey, operation flows, risk mitigation of prognosis, patient monitoring, and hospital operations, back office. Where are you seeing the most immediate and scalable impact of AI in healthcare today? I would like to bring Dr. Manisha first. Your thoughts, please.
Actually, the AI, I feel we are already in action very much, like other part of the other countries. Mayo is already full-fledged driving it with AI-based, personalized care pathways they are designing.
Okay.
NHS is building a lot of triages which are happening at a national level.
Okay.
Similarly, India is also doing into the nationwide, it's already started for tuberculosis screening.
Okay.
So it is basically covering a lot of larger sector
Okay.
into the diagnostic field, which is able to reach out different places. Me being, I'll tell you my personal example. I'm an emergency medicine and ICU consultant.
Okay.
Now I'm an administrator for last 15, 20 years, but previously 25 years I've practiced.
Okay.
And we have seen that it is that all the places, rural areas are not covered. By the time patient reach out to the major cities, already the case is out of hands or they are into the struggling phase and they spend a lot of money. This AI will help us to reach out farther away into the rural areas. The diagnosis will be much more better, earlier. And this will help us, the prevention much more better. And by the time if something is really coming out, then only the patient will reach out to the main cities. The doctors will get a better time.
Okay.
So the diagnostic way, the telemedicine way, whether it is into the operational efficiency, AI is really going to make wonders and it's going to empower doctors much more. No way it can replace humanity. No way it can replace the doctors, but it will empower better. But this message of the AI has to go percolate down the line very well in a proper way, that it is not at all the replacement, but the empowerment has to be used ethically. The data has to be used ethically driven with the patient's consent, which will help us to build the trust among people. And I think it will be having a wonderful journey, and India can make a very global, unique example how AI is driving the healthcare.
Brilliant.
The world can sit and watch.
Okay. Thank you, Dr. Manisha, on that wonderful point. So your summary is the last mile connectivity, what we call, is definitely can be enabled using the power of AI technology. And also in the quest to democratize the quality of healthcare using AI. I think it serves both the purpose. That's the power of AI. Okay, thank you. We totally agree with that. And that's our vision and our chairman's vision as well. So thank you. Manisha, can I request your comments on this, please?
I actually want to bring a personal element for me because for me, this is very, very special. I'm going to be a mother in a couple of months now. So for me, when I think about healthcare and AI, the vision that you have, and that's where I've been working for so long, right? About health and equity of how do we make it accessible for women and children. And what makes me most hopeful about AI is that I believe it's gonna be the level equalizer for health equity in India. What I mean to say that, just like as Dr. Manisha said, I'm also grateful to have my younger sister, who's Dr. Samta Charoria. She's an MD in emergency medicine at AIIMS Delhi. So every time we speak about it, I think what she also shares back to us is that, sometimes in her cases that come, the golden hour care, as we say, right? Can someone who is located very remotely, a woman or a child who is about to deliver a baby, can a nurse, can a physician, who probably is not a specialist and doesn't have access to, say, Dr. Manisha or Dr. Samta or some other specialist doctor, can provide that golden hour care, which might have made a lot of difference to the outcome till they actually reach to the point where healthcare is accessible. So what I believe is that the patient journey in this whole ecosystem of AI in healthcare will ensure that India is no longer dependent on zip codes and pin codes for people getting access to healthcare. It will probably move out of that so that healthcare is accessible and is equitably available, irrespective of where you are and where you belong.
Very good. Very inspiring thought. And so you talked about the importance of patient monitoring for the critical cases, so the lives can be saved, and so technology can play a huge role. So very inspiring thought. Thanks for sharing. Now I would like to bring Ravi for your comments, please.
Sure. Just again, speaking from personal experience, I'm part of a trust which runs a chain of hospitals. It's called Sri Satya Sai Sanjeevani Hospitals. What we specialize is in pediatric cardiac care. There are about 2.5 lakh children are born in our country every year with a hole in the heart. And as a country put together, we have only about 60,000 consultants, surgeons, or cath interventionists put together. So we have a huge gap. As we speak, the estimates are about 20 lakh children are waiting for their surgeries to be done. Right? That is, if you know that your child is sick, if you know that your child has a hole in the heart. So what we have done, I think the biggest problem is to identify the issue to begin with. Earlier, what used to happen is that a cardiologist had to go, or the patient had to come to the cardiologist to be able to diagnose or even screen at a preliminary level if the child has a hole in the heart. Now, we have tied up with a US-based firm set up by an Indian. They have developed a smart stethoscope. Now, what it does is, anybody with about 30-40 minutes of training, they will be able to put the stethoscope on the chest of the child. It's connected using Bluetooth to a tablet. It will indicate if the child potentially has a congenital heart defect. It's not confirmative, it's indicative. So we have tied up with some public sector units in India, and in the last 1.5 years, we have screened 1.5 lakh children in the most remote areas. I'm not talking about cities, I'm not talking about towns, I'm talking about Bastar forests in Jharkhand, in very remote areas of Uttar Pradesh, the coal belts. Out of the 1.5 lakh children screened, we have identified about 2,500 children who are suspects. And we have done 1,100 surgeries. Again, the uniqueness about the hospital chains is there are no billing counters. Everything is provided totally free of cost. And this is the democratization, right? This is the power of AI. This is the power of a tool to be able to pick up a problem, and it's a force multiplier. You don't need specialists on the ground in every place. You are moving the doctor, the eyes and hands of the doctor into the remote areas using a very beautiful tool. An example like that you've already shown there. And then, the next steps can be done in cities and towns and all. I think that's where this is going to be a game changer for us in a country like India.
Okay, thank you, Ravi. First of all, congratulations on this wonderful initiative. We are very touched, and we would like to congratulate you and for all the good work you're trying to do. I'm sure it's an inspiration for other NGOs that we are working with.
Thank you.
Yes.
Thank you.
Yes, beautiful. Yes. So one is technology, one is doing it It's a rare combination. I also totally agree the importance of using the right tools, which is enable IT, and in delivering those, democratization of the quality healthcare. Thanks for sharing. And the last questions I would like to bring Sumit for your last comments on this question, please.
Yeah, so I think healthcare as a sector is just waiting to be disrupted, and AI is going to play a very huge role in this. There are multiple things that are possible right now, like radiology, diagnostics. We've talked about the fact that triaging can happen, clinical decision support systems can be augmented. We can clearly look at remote care monitoring, many areas. In fact, drug discovery is going to become very powerful. I think the challenge is not AI, the challenge is the way we want everything else to support AI. Mm-hmm. That's the problem. And I can give you a sense. 7-8 years ago, I went to Amsterdam for a conference, radiology conference, and there they were all, Europe, many top radiologists from Europe, and they told me then that about 80% of radiology using AI was accurate, 80-85%. And a normal radiologist is about 70% accurate. But the remaining 15-20% was so bad that nobody was using it. And nobody was training it, because if you trained it, it would probably become so much more advanced in the last 7-8 years.
Okay.
So there is a need to get people, system, process to work together.
Okay.
To make this really effective. That's one. I will also talk about a few areas that probably hospitals do not have the capability to do well, because doctors are stressed for time. The diagnosis piece, we tried using Babylon Health and other areas to enhance diagnosis per se. You have to have technology being available to the patient, patient-centric. Let the patient enter information. And again, this could be a good tool by which you get information entered, and then you have information available to the doctor to use his time better. Okay. Those are opportunities. I'm doing that in Prana AI. I'm trying to basically give a civil score for wellness, trying to do those gaps, plug those gaps that hospitals are currently doing, trying to make it more useful for the patient in a very customer-centric manner, enhancing safety, enhancing access, enhancing equity. Those are the possibilities that can happen with AI.
Brilliant. So basically patient data on demand, so that you could build all this support system around that. Okay, thank you. So moving on to the next questions, it's maybe more towards the pharmaceutical industry, which is embracing AI like anything, as we see from our experience. The question is, how is AI adoption impacting the pharmaceutical industry across the following areas, from production, testing, documentation, and compliance readiness? So request Manisha, with a rich experience in the pharma, comment on this, please.
Sure. I think it's no news to everyone that when it comes to investment in tech right now in pharma, of course, the highest growing segment is AI when it comes within the AI and tech, right? And across the value chain, whether it comes from all the elements that you said just now, from production, which is R&D, documentation, compliance, AI is playing some part or the other role, or it's being set up to play different kinds of role. But what I think I would like to talk about, one use case which I'm seeing, I think the pharma industry is most excited about, is how today AI is enabling our knowledge disseminators on ground. What I mean by this is our field representatives, which are there on the ground. India has about 6 lakh field representatives today who are, are kind of, I would say, the bedrock of pharma industry, who are being that knowledge representatives who actually help us connect to such amazing physicians who are the point of care, right, for patients. Today, AI is making it so easy that everything that would have, suppose a new drug comes out or a pharma industry builds up a new molecule, a new test, it would take so much of time to build the correct set of synthesized reports, communicate it to the, at different levels of hierarchy, go down across and then actually reach our people who are on the ground, and then make it easy for them to be able to share and discuss that with our physicians on ground. I think that's become so much simplified because of the availability of AI. I call it like intelligence on your fingertips. And what that helps is that we can now expect that our physicians, who are the most important for us to be able to give that access of care to patients, and our knowledge representatives can actually build a more relationship-based discussions, can be actually more present at the moment, so that their conversation is focused on care, is focused on the patient, is focused more on empathy, and we can leave the human mechanical burden for the AI to do that. So I think that's something which I feel is one of the most exciting cases in the pharma industry today.
Very good. So very nice to hear that. And in fact, we have a very focused solution offering for the pharma in line with what you just explained. Happy to hear it, and I totally agree with what you just said. Thank you. One last comment from Sumit on, I know you have come from the insurance industry, but you have dabbled with all other areas. So your point of view on the impact of AI in the pharmaceutical industry, please.
Totally. I mean, if you look at it, actually, it is the age of collaboration. We've seen during COVID how everybody collaborated and we got the drug discovery done much faster. The COVID vaccination came in very fast. So there is definitely going to be an element of, of fast tracking drug discovery. There's going to be an element of clinical trials and testing becoming much faster. But there are other aspects also to this. We could probably be doing much faster documentation. I would say even predictive maintenance. We could do better in predictive maintenance for manufacturing facilities for pharma industries. You could probably do very good waste reduction. You could have excellent ways in which you could optimize costs in that sense. So there are multiple areas. As I said, we just need to combine process with people and...
Okay, optimization, cost efficiency, process efficiency. Okay, great. All right, so moving on to another interesting questions, which is fundamental as we all discussed, the importance of data. So the question is, data interoperability remains a major challenge across hospitals, labs, insurers, and government systems. How can India build a more integrated digital health ecosystems with these constraints? I would like to bring Abhay to start with.
I think we already have a physical example for it. That's what I think we are discussing like when we show this product. Interoperability, normally when we talk about, if we look at from a perspective of just a data exchange, I would say just a half job done, to be honest. Because it is more about tracking the entire patient journey. So in this case, as we said, we required an integrated system. An integrated system will only work when we reach out to the last mile, right? So when we work through this product, the Health ATM, so the whole point is how we can, first of all, capture the patient vitals. That is the first step for any patient journey, right? Understanding before even any medical condition happen to a customer, happen to a patient, before that can we catch those symptoms. So system like this will be the first point of contact between a patient and a doctor, I would say. Then on top of it, we have to bring these things, because if all this system works in silos, it is of no use. It has to come together, right? So with this, we are capturing vitals, then telemedicine, connecting doctor and patient via video call. Diagnosis, when we say for laboratories, this system can work as a point of, as a collection centers where high-end tests like CBC, LFT can also be done. The blood collection can be happen through these systems, and the system should talk with the diagnostic labs. So when the result comes, so system automatically captures those data and provide a single point of, single view to a patient. On top of this, if a patient wants to go to a hospital, if a doctor say, basis on this, we require a hospitalization, the system recommend those things. So all the system, whether it's hospital, diagnostic lab, pharmacy stores, if doctor recommend any medications, so pharmacy stores, it should automatically go to a pharmacy store and pharmacy can deliver those medicine to a patient. So everything has to work it together in tandem. That is where I think we can have a connected system. And once we have this data, obviously, our system works with ABHA. So likewise, we have, whether the system, one is that we are working on it through integrated system, and government is also doing its own task. The way they are trying to bring ABHA into the picture, that's the whole point. How we can get data from the hospitals, diagnostics, pharma, so that when a patient walks in to any hospital, they don't have to carry any documents. All these documents will be connected to their ABHA ID. So that's the whole point. So along with interoperability, we need to have a connected system which reach to the last mile.
Okay, thank you. So the data mapped to the patient journey has to move in horizontally, cutting across all the relevant related systems, so that the ecosystem becomes more holistic. Okay, thank you, Ravi. Thank you, Abhay, sorry. I would like to bring Dr. Manisha for your comments on this question, please.
Very rightly put forth by him. So, I think I'm audible. Yeah. So I feel that this interoperability, connectivity, it is happening at multiple level, but it is happening at an individual level. Every organization is working. India is very rich into the corporate setup. Also in healthcare, it is growing leaps and bounces every day. Multiple hospitals are coming, and everybody is trying to maintain and secure the data of their own organization. But it is happening that a patient visiting their organization becomes their property. We are not working for the benefit of an individual as an overall.
Okay.
So I think India has a great opportunity, especially under the able leadership of our PM Modi ji. I'm sure it will happen soon, that it should develop it as a public infrastructure. We should able to develop. So all this interconnectivity, it has to flow through a single system.
Okay.
It's like each and every hospital, laboratories, insurance sectors, every creditors, every small clinics, wherever the patient's touch base points are, all the data has to flow through at one place so that we have the right set of data, where the policies and platforms, whatever is government is creating, it doesn't remain on paper. They'll able to implement, because then they'll get a rightful data and how many diseases are flowing right now in India. The preventable measures can be planned very well. And while doing this, the government has to be built a very ethically driven system, so that it has to build trust.
Yes.
You rightly said that trust is very important.
Yes.
And without trust, it cannot happen. Every data has to be built in so much of a trust. Right now, every individual with so much of technology getting developed, we do not even share a password with anyone.
Yes.
Forget about your individual personalized data, which
Correct.
is having in the entire healthcare into it.
Correct.
So that accessibility should be there, but the data has to be stored and it has to be useful for the people's development. Then definitely the entire community. So it is a responsibility of each one of us. Entire community has to be together to drive it, so that the technology can be utilized in the right way for our own development.
Okay.
So it is not the enhancement of the life that you are extending only the span of a life, but it has to be driven with a compassion, with a humanity for what our Bhagavad Gita and our India has been built on. The seva has to be formed.
Yes. Yes.
And our Hippocratic oath has to be remembered by every healthcare worker.
Thanks. No, fantastic point. In fact, I had this experience when I was talking to a hospital. First they said, so where does the data sit? It sits in a cloud. Are you sharing with any pharmacy company? I said, absolutely not. So that once you become a custodian the custodian of the patient data, the trust becomes very important. And and also the importance of centralization versus silos certainly becomes very fundamental in terms of delivering that patient-friendly ecosystem from the digital health perspective. Great point. Thank you for sharing. I would like to bring Troy for your last comment on this.
Yeah, similar thoughts here. What I visualize is, with interoperability, India needs to develop an application like our UPI. The way we are using UPI today, multiple banks, multiple financial institutions connected, but the user has flexibility to interact, send, receive, and all that complex transactions. The same way, we need to have a unified health interface probably, where the patient can interact with multiple, let's say, laboratories or hospitals, clinics, and all that in a free manner. So I don't support also centralizing the data at one place and then access. Let the data be there where it is, with the lab or with the hospital or with the clinic or wherever it is, be it Ayurvedic or be it the normal hospitals and any healthcare institution, right? The data would be there. Develop that application which will follow all the standards our panelists explained, and then the data can be mobilized from one place to another with the patient's approval. Okay. So that is what I think would be the right way to go on.
So I totally agree. I think ABBA is headed that way, because the ABBA ID was created for the same reason. But unfortunately, one way, I think everybody is doing it the other way. Once the care is done, the data is not going back and sitting on the cloud. But I'm sure, I think that there is a step in the right direction, but definitely I'm sure it will evolve in the coming days. Thanks for sharing, Troy.
If I can just add one bit there, not taking too much of time. At least in one of the states that we operate in, what the government has done is, if you are not sharing these, let's say you are a hospital that applies for Ayushman reimbursement, if you are not sharing these patient records on ABHA, you don't get reimbursed. So you are pretty much penalized and forced to use the system, which is okay in a particular way, because the patient data has to be available on a digital public infrastructure, and only then this interoperability will be a reality.
Agreed. So, yeah.
In fact, government is also incentivize it. So I was sitting with a couple of NHA people a couple of months back, and they have the scheme. If you create an ABA ID of a patient and sync the data, government give you X amount of money for every transactions.
Oh, nice.
So government is also trying its best so that people can start utilizing it, incentivize them so that at least they sync the patient data. And as I said, the money, if in the case of Ayushman Bharat Health ID, that money will only be reimbursed if you sync those data files of patient to the ABA's ID.
Okay, great, thank you. So since we're talking about public health, since you have done a lot of work, maybe I would like to ask one question to you, Ravi. AI has the potential to bridge, healthcare gaps between urban and rural India, which you're already doing it. What practical solutions can AI bring to improve the access and affordability? Please comment on access and affordability, I think in the work that you are trying to do in the public health domain, please.
Sure. I think what we need is a double engine sarkar here. What I mean by that is...
We already have.
in a slightly different way.
Yeah.
I'm talking about driving AI-based healthcare devices top-down and bottom-up. Right, top-down is similar to what you have here. The gadgets that we use, it's called HD Steth, to institutions taking AI-enabled technology into the grassroots level. That probably will be the case for for a lot of our rural population. And also the other side is the bottom-up approach, where you're using the variables, right? The continuous monitoring. It's not episode-based care anymore, it's continuous-based care. So when these two merge together, I think the divide that we see, Manisha talked about your care cannot be based on what your, where your zip code is. So we're going to blur that line, right? If you're able to get these devices out to the people. I wish the gentleman from UP was there. I would have strongly recommended, apart from the laptops that were given, give wearable devices to all these people, because that's where the data is going to flow in huge volumes. That's where your LLMs can actually have real meaningful data from the country for the people of the country.
No, he told me he's going to buy 1,000 machines. So your concern is already addressed.
Lovely. Congratulations on that.
Thank you.
So, yeah.
Okay, thank you, Ravi. I think we have last round, and we'll call this as a rapid round, 30 seconds each for all the panelists. And the question goes like this. For healthcare leaders today, what is the single most important strategic decisions they must make to future-proof your organizations? I'll start with Ravi, please.
Sure. I think it has to be, if I think about it, it's interoperability. Whether you have within the hospital also, even if you're having different softwares, being able to publish in ABA, interoperability, I would say, is probably the single most important thing that you need to invest on. Even if you're investing on individual AI tools, they all need to talk together. I think that's critical. Otherwise, this longitudinal health record, we're moving from the individual episodic health to longitudinal health record. I think that's not going to happen without interoperability.
Okay. Interoperability is the key.
Yeah.
Okay. So, Abhay?
So I would say collaboration is the key. Obviously, interoperability is also part of it. Today, people earlier which have apprehensions of not sharing this data, considering of their own reasons. Today, if anyone want work in silos, they will not. I would say they will become Nokia. Okay. So today, if you won't adopt AI, won't collaborate with people, like we work with all the device manufacturers, we work together, we use multiple multimodal AI systems. So it's not like we want to develop our own models, we want to develop our own devices. The time is not there. You have to work, you have to run very fast. You have to, collaboration is the key, else you become Nokia.
So bring in the collaboration with the ecosystem players. Okay, good point. Sumit?
Yeah, I would say collaboration is the key, and I think the innovation today is in collaboration, not so much in technology. Technology is already up there. What we need is to move from hospital-centric systems to health-centric ecosystems. That is what will create a huge difference in the outcomes that we can see for patients, and we need it across the countries, across the world.
Very good. Thank you. I totally agree with this. Dr. Manisha?
Yeah. So I would like to say what personally I face every day in the hospital. Our KJ Somya hospital has been awarded 3 times consecutively for serving the highest number of the MJPJY and Ayushman Bharat scheme.
Congratulations.
Still, I find the huge challenges when the patient come to us. They are not aware about what all the hospitals are tied up. So the government is focusing basically on the major hospitals. So the digitalization should take place really at a primary ground level. We are surrounded with a lot of slums areas, a lot of primary healthcare centers, ASHA workers, the smaller clinics, If we make them digitally empowered, we'll get a huge data and the interoperability, what he rightly said, it has to flow. The data has to flow really so that the patient can get a better care and we can serve them much more better, even what we are doing now.
Okay, so importance of access to the patient data very early in the cycle. Okay, thank you. Manisha?
I think I'm just going to be adding probably to what my co-panelists say, right? I do believe the problem or the challenge with AI is not just the technology. It's going to be the adoption of this AI as a technology. And that, as I think my co-panelist said, that's based on trust. It would need all the ecosystem players to probably come together. And I'll just end by saying like one phrase. It's just only, I think, day before yesterday, my house help actually first came up to me and said that, Didi, school mein cervical cancer ki vaccine laga rahe hain. Like you're having a cervical cancer vaccine being put. Should I get my daughter vaccinated? So it took like from US to us to actually get a cervical cancer vaccine about 20 years or so. And that wouldn't have been possible, as I think all my co-panelists said, that you need policymakers, you need physicians, you need us to make vaccines. We also need people and providers to actually get that to it, right? So it has to be an ecosystem play, a collaboration game, and then that's only going to make sure that India becomes a reality to making sure there is health and access to medicines for everyone.
Okay, brilliant point. The entire ecosystem players has to work in tandem to deliver the results. Okay, the last comment from Try.
Yeah, I have similar thoughts here, like adoption, Manisha said, right? So training is another part of that game, because even today, when we implement solutions like hospital management system, even doctors hesitate to use it because they don't want to type and all that, right? So they want to write something and on behalf of them, somebody
has
types,
to translate
right?
it. Yeah.
So same applies to AI also. People have to be trained. And in healthcare industry, training healthcare people on AI is more difficult than training AI for GCC people or technology people, BFSI people, right? They can learn quickly, but healthcare might need some more time to learn.
Absolutely.
So I think that is one part. And another part is, in order to make your organization future-proof, you need to identify where you want to implement AI to leverage maximum benefit.
Okay.
It's not necessary that you implement AI everywhere, right?
Correct.
For example, in a hospital, I think maximum time the healthcare people sometimes spend is addressing the compliance part, the insurance part, right? Different insurance companies have different, processing policies, rules, and so on, right? So sometimes I have seen, like, nurses also get engaged with that, because some insurer says they will not approve, let's say, OT consumables, they will not approve, right? So all those rules have to be reviewed by a healthcare professional, right?
Yes.
So if we can train our AI model to do that task, I think we can free up healthcare people to give care to patients than spending more time with the process.
Okay, great.
So
Thank you.
That would be my recommendation.
Yeah, so you talked about the importance of skilling. So I think so that is one of the important core offerings of our Regenesys. We start with skilling because we make people AI literate first so that they can appreciate what AI can bring to their organizations. I think we completely align on that. Thank you for sharing. And I wanted to check with the team. Do we have any questions for the audience, or one last question, if I may? Anybody?
Abhijit.
One question?
Abhijit.
Before we wrap up this discussion?
We finished on time or before time?
Yes, I think I've been getting
Well
things.
done.
Yeah, hi. Hi, good afternoon.
Yes,
My
please.
name is Abhijit. I work with a lot of businesses and technology leaders in East Africa. So I have a question. Is this the data? Is it the currency for AI in healthcare? Especially in Africa.
Absolutely. Who wants to take up that question? Yes, go ahead, Sumit.
I totally agree. I think data is the new currency, also for healthcare, for sure. I can tell you, I worked in Kenya. I was doing, we were doing projects in Nigeria, multiple other countries during COVID. And one of the things we realized was that what works in India does not work in Kenya. What works in Europe does not work in, let's say, Africa. Very different. So you have to contextualize the data. Data is very critical. Need to make sure quality of data is properly given attention to. And then we leverage it effectively. I was working in Max Hospital at some point. Because we were able to get a single view of the customer, we were able to get 30% EBITDA for Max Hospitals. Even today, it's 30%. It's single systems, electronic health record systems, single hospital payment systems, versus others who probably have 10 systems for the same hospital chain. So data is the key. You will need data everywhere in each country, but contextualize it to that geography.
Okay, great. I think we need to wrap up, I've been told. So thank you very much, all the panelists, for your time today. It was wonderful. And we learned a lot. A big round of applause to all the panelists, please. Thank you, everyone.
Thank you. Please be seated. This was a conversation that was as thought-provoking as it was deeply human. Thank you, Manoj, and to each of our panelists for bringing both vision and responsibility to the discussion. I'd like to now invite His Highness, Prince Palden, to come and felicitate the panel of speakers. Please. Please continue being on stage for a group photograph. Thank you.